Hi, my name is Greg Fell. I'm Director of Public Health for Sheffield. This is a situation report dated today, the 15th of February. Three things, epidemiology, isolation and vaccination. So epi first. R is below 1, almost certainly, that's good to know. It's only just below 1, and I expect it won't fall to the rates it fell to last summer where R was 0.6. So I think it's going to hover just below 1, which is awkward and quite difficult to manage. Numbers, the 7-day infection rate is coming down pretty steadily. The last number that I saw was about 150 per 100,000. I think it will continue to come down for some time to come. I don't know where it will settle. The highest, look at age bands, the highest rates are in the working age. Unsurprisingly, the working age people are at work. They're out and about more. So as a result, there's more exposure. Therefore, there will be more infection. The rate in the elderly is coming down. It's coming down reasonably quickly, actually. And obviously, as I've said before, that's the group that we worry most about. The hospital is definitely past the peak, but still hugely busy, so always a difficult time of year, and obviously the hospital and the rest of the health and social care system, particularly primary care, is really very busy vaccinating people at the moment. So whilst we're all past the peak health and social care system wise, it's busy, and hospitals are busy, as is primary care and social care. Given where we are epidemiology wise, we have a high baseline rate of infection and are just below 1. The potential for a rapid flip and a rapid escalation remains, and there's not much to no room for manoeuvre within the NHS and social care system. But all up, the epidemiology is definitely going the right way. That hasn't happened by magic. It's happened because many people in the city have done the right thing over a long period of time and have followed the rules. And thank you for that, because that has made a difference. Whatever happens next, we're in the run-up to the Prime Minister's review in early March. I expect we'll need some form of public health interventions for quite some considerable time to come. Testing, contact tracing and isolation, but also other interventions. There will be an ask of the Sheffield public to continue washing hands, wearing face masks, keeping distance, limits on mixing, stay at home if you've got symptoms or asked to isolate. That will be with us for some time to come. Those things have made a massive difference and have saved a lot of lives compared to what would have happened had we all ignored them. And I expect that will continue, so it's important that we're prepared for that. So next up is self-isolation. Definitively the most important thing you can do to stop the spread of coronavirus, the single most important thing you can do. If you have symptoms, even if they're mild symptoms, or you test positively, or you've been contacted by NHS Test and Trace, you are legally required to self-isolate. Beyond the legally required to self-isolate, it's the single most important thing you can do to limit the spread of infection. So what does self-isolation mean? It means staying at home for 10 days and not going out unless you're going out to get a coronavirus test. It means not having any visitors to your house, which you shouldn't be doing anyway, unless they're essential care workers. It's not easy. We all know that. It's not easy. And it's one of the hardest things about coronavirus. But self-isolating is saving lives. You will never be able to see it. You will never be able to count it. But limiting the onward spread of transmission undoubtedly has saved lives and will continue to do so. And if you're thinking about not self-isolating, think of the impact on others. You may never know who else would get infected if you don't self-isolate, but it will have an impact somewhere, somehow, and that's what's at stake here. It's important. It's the single most important thing to do. To help, we've created a self-isolation pack, which will be going out fairly broadly across the city over the next couple of days. You can view it on our website, and the link will be at the end of the video, and you can request a printed copy that can be posted to you, or call our community helpline, which is Sheffield 0114 273 4567, and these copies will be available very soon, and we'll let you know. The pack contains loads of information and advice, such as when and why you should self-isolate and how long, the details of all the support that's available, including financial support, how to plan in advance, so that should you be asked to self-isolate, and it probably will come out of the blue, you'll be ready because you won't be able to pop to the shops. Some ideas for filling your time, because 10 days at home is a long time, how to treat coronavirus symptoms at home, and stories from people who've been through it. Always good to learn from people who've been through that. There's also some good information in terms of how to prevent the spread of coronavirus from you, should you be the person who's tested positive, to other people you live with. There's some simple practical things that we can do to limit in household spread, and those things are important. So it's worth remembering that if you have to self-isolate and will lose income as a result, you might be able to get a payment of up to £500, and there's more information on how at the end of the video. So I'd just like to again thank everyone who has self-isolated and who will self-isolate. You are making a difference to the city, and thank you for doing so. Last up today is vaccination. As you will know, the vaccination rollout continues. It enters its next phase today, and the jab has now been offered to everyone in the UK's top 4 priority groups, so we're now rolling into the next groups. So thus far to date, 15 million people in the UK have had their first dose, and here in Sheffield we're on about 130,000 people who've had their first vaccination. That's a significant number of people, and credit to all those who've made that happen, because that hasn't happened by magic. The rollout in England has now been extended to the over 65s and to younger people in at-risk groups. If you are eligible, you will be contacted. So please, as per before, don't contact your GP. You will be contacted, and again, these things will happen quickly over the next week or so. So it's great news that almost all over 70s have had their first vaccination, but it's worth me reminding people that the immune response in your body doesn't start until after, or until about 3 weeks after the first jab, not straight away. So don't expect or build of the understanding that there will be an immune response straight away. It takes about 3 weeks, and you won't be fully protected until at least 3 weeks after the second jab. So some caution will be needed for some time, until we've got a very, very, very well vaccinated population who've had 2 jabs.